For necrotizing enterocolitis, we say it's actually one of the most common and serious gastrointestinal emergency in newborns, that's neonates, especially the ones that are actually premature. Okay, so it involves ischemia and inflammation of the intestinal wall. Do you understand? So it could be that the intestinal wall was perforated, but anything that is actually what affecting the blood supply, could lead to this. Okay, then sepsis. So sepsis can also cause necrotizing enterocolitis in newborns. So it affects preterm infants mainly. So children that are born below 32 weeks suffer from this the most. So in the neonatal intensive care unit, the cases there, 1 to about 5% of cases there is due to what? Necrotizing enterocolitis. So pathophysiology sometimes is prematurity, so the gut is not really strong enough, the immune system is not up. Do you understand all those kind of things? So any insult there progresses so rapidly. The enteral feelings, ischemic hypoxia, okay, a lot of things. So clinical features is abdominal distension because of the inflammation, feeding intolerance, the child doesn't want to feed again, bilious vomiting, so they are vomiting greenish vomit, bloody stools, that's hematochezia, lethargy, apnea, temperature instability. Okay, so diagnosis is to do abdominal x-rays. So most of the times you see what is known as a pneumatosis intestinalis, that's gas in the bowel wall. Alright, portal venous gas. Then you can also see free air, a lot of air in the stomach though. So if you do lab tests, you usually see that what white blood cells could be high or low, depends. Okay, so you could see leukocytosis or leukopenia, depends. Metabolic acidosis, then thrombocytopenia. So management is first of all bowel rest, nasogastric decompression, broad spectrum antibiotics, because you want to handle already set in infections or handle infections that will set in. The intravenous fluid, parenteral nutrition, and the rest of them. So surgical procedures is if there's perforation, inflammation of the peritoneum, that's peritonitis, you might actually want to opt in for laparotomy. Okay, and basically what? Stabilize the child, maybe cut the part of the intestines that is dead, then reanastomose the viable parts back together. So that's what we have for what is known as the necrotizing enterocolitis.